Hey, welcome to my YouTube channel. My name is Miriam and I share healthcare related issues. Now, on today's video, I want to share some areas of specialty you can work with a CNA license. You having a CNA license, you're not limited to maybe just group home or assisted living. You can do much more with your license. So yeah, let's get to number one, specialties. Now, this is in random order. It's not according to importance or so. So the first one is a rehab nursing tech. With a CNA license, you can work in a rehab facility, and yeah, the same rule apply, the same responsibility apply. In some settings, you might be responsible to get vital signs and then assist the patients with activities of daily living under the supervision of your registered nurse, the occupational therapies, the physical therapies, or even the speech therapies. So yeah, that's that for rehab nursing tech. The next specialty you can try with a nursing assistant certification is an acute nursing assistant. So, who is an acute nursing assistant? They work in hospitals basically, and usually maybe in intensive care units. Yeah, their role might be a little bit more demanding in the sense that they might have to, in addition of vital signs, they might have to take blood draw, perform EKG. Yeah, they might have a lot more of other skillful responsibility. So if that sounds like what you're interested in, you can try. And I love acute nursing assistant because it helps you to learn, especially if you have interest in eventually getting into nursing school in the long run. Now, the third specialty you can look into with a CNA license is a dialysis technician. Now, what does a dialysis technician do? Dialysis technicians, they basically hook dialysis patients onto the dialysis machine. Yeah, so that's basically what they do. I don't know much about it, but you want to look, try to research on it if it's something you would like to do. And yeah, so the fourth, right? The fourth on the list is a home health aide. If you're someone that doesn't like the hospital setting or an inpatient setting, you might want to look into a home health aide. There you get to work with patients in their home, and that is something that some people prefer if you're not a you don't like the hospital busyness and interactions with other healthcare professionals. You might just want to look into the home health aid where you get to work just with your patient under the supervision of your nurse. Yeah, so yeah, the next specialty you want to try is the psychiatric tech or the psychiatric aid. Now, psychiatric aides, they also work in the hospital, but I think in psychiatric units, and they work with patients that have mental disorders. So yeah, that's a specialty you can try or you can look into with your CNA license. Another specialty you might want to look into with your CNA license is maybe getting your geriatric nursing assistant. Now, with this specialty, you work basically with the elderly. Now, in health, you work with the elderly, and this setting most often is in group homes, assisted living, nursing home, and yeah, and most often geriatric nursing assistants even work in other specialties. I mean, like they are mostly in nursing homes and everywhere you can find seniors. Now, another specialty, I don't know, maybe that's the number 5 or 6. I lost count, but I think I'll put that in once I'm editing the video. The next specialty you can work as a nursing assistant is you can work in a doctor's office as a medical assistant. Yep. So Basically, what does that entails? You are responsible to schedule activities, schedule appointments. Um, you equally perform vital signs. You register patients, take the vital signs before they see the doctor. And some go to the extent of performing, I think, basic assessments before the patients see their provider. So that's another specialty. So far, let's see which one I haven't touched. Yeah, I think basically that's all. You have so many other areas I haven't even mentioned in this video, but I mean, your CNA license is just a baseline. That is something you can do much more with. And yeah, so comment down below if you have questions or if you have interest, whatever you would like to watch, let me know. I might have to upload and do more research on that. Thank you for watching.